Good morning, Mrs. Jones. My name is Kyrie. I'm a student nurse at the University of St. Francis. I'm going to be assessing your baby today. So the first thing I'm going to do is wash my hands according to the hospital policy, which is typically about 3 minutes. And then I'll come over to baby and check the ID band, make sure that I have the right baby, and I do. So then I'll go on to vital signs. First, I'll do the temperature. The normal temperature for a baby is 97.5 to 99.5. Go ahead and put this under the arm. Looks good. And then I'll go on to breath sounds, heart sounds, and bowel sounds. I'll listen to all of those for 1 full minute. The normal breath sounds are 30 to 60. The normal heart rate is 100 to 160 for babies. And bowel sounds should be active, so I'll go ahead and listen there. Again, listening for a full minute. Baby looks good. Bowel sounds are active. The lungs are clear bilaterally. The heart sounds good. So I'll go ahead and cover the baby back up. Keep him warm. And I'll move down to the head here. Take the hat off. I'm just feeling for any molding, which is normal, but I would definitely want to chart that. I would look at the anterior and posterior fontanelles. They should be soft but not depressed. That could indicate dehydration. I'll look at the suture lines. Make sure that there's no caput, which would indicate or be shown as swelling throughout the head. I will also look for cephalhematoma, which would be just on one side because it cannot cross the suture lines. And that looks good. I'll go ahead and look for any scabs, bruising, that may have occurred during the birth process. This baby looks good, so I'll go ahead and lay him back down. I'll move down to the eyes. I'll start with the epicanthal fold. It looks like this baby does not have one, which would mean that there is no indication of Down syndrome and this baby is not Asian. I'll look for discharge, and I'll also look for any hemorrhage in the eyes. I'll pull down the eye. I'll make sure the eyes line up with the top part of the ear. And then I'll move down to the ears. I'll pull them back up and check for recoil. That side looks good. I'll do the same to the other side. If the ears do not recoil back immediately, that could be a sign of premature baby. And then I'll move down to the nose here. I'm just checking the patency of the nares. That side looks good. That side looks good. Now I'll move on to baby's mouth, but I need to wear gloves for this part. I'll start at the side of the mouth to try to get baby to open his mouth. And once he does, I'll feel the hard palate and the soft palate, checking for cleft palate here. And then this also checks for the sucking reflex. Baby looks good. Go ahead and slip the hat back on to keep him warm. Take my gloves off. Then I'll move on to his neck, taking 2 fingers, feeling for any masses here. This baby does not have any. So I'll go ahead and check his range of motion. Looks good. Then I'll start to uncover baby a little bit here and move down. I'm going to check the clavicles here, make sure that they were not broken in the birthing process. And then I'll move down to the baby's abdomen, which is slightly rounded, and it is pink. I also want to note that if the baby were in respiratory distress, we would look for nasal flaring, we would look for retractions or seesawing of the abdomen, or we'd look for apnea greater than 20 seconds. So while I'm looking at the abdomen here, I'll check color, which this baby looks pink. I'll check for any bruising, scars, scratches, or peeling. This baby does not have any. I'll look at the umbilical cord here. Looks like it's healing nicely. There's no discharge and it is dry. And then while I'm here and have the baby undressed, I'm going to check for skin turgor. So I'm going to pinch a spot on the belly and it should bounce back immediately if the baby is well hydrated. Do the same thing on the thigh. And then when I'm going on to the genitals here, which is the next step, I want to put gloves on. Now I have a male baby, so I'll want to look at the rugae on the scrotum, which he has an even amount here. I'll look at the meatus on the penis, that should be on midline. Then I'll check for, to see if the testes have descended. Do that real quick here. Looks good. I'll check to see if he's circumcised. And he is, and he's healing well. No discharge or excessive bleeding there. Now if I would have a little girl, I would want to check for discharge or bleeding. Any little bit of bleeding or discharge is normal. I'd also want to note if the labia majora covers the labia minora and the clitoris. Cover baby here. So I want to check the tone of the baby, so I'll start with the arms here. I want to lift it up and bring it back down and hold it for 3 seconds. The baby's arm should come back up. And then I'll do the same to the other arm here. Comes back up, good. I'll do the same thing to the legs here. Lift the leg up. Pull it down for 3 seconds and it should spring back up, which this baby does. Do the same thing here. And then I'll take a look at the palmar creases here on the hands. He has 2 or more on both hands, and that's normal. If there was only one, that could indicate Down syndrome. Also has 5 fingers on each hand. I'd also note if there's any webbing or an extra finger. He does not have either. I'll move down to the feet here and look for the sole creases. And it looks like he has 2 or more, which is good. And then he has 2 or more in the other leg too. And I'll check for Babinski's reflex here. So I'll make a backwards J on his foot, and the toes should flare out. I'll do it on the other foot here. And that flaring of the toes is a normal response. And then I'll undress the baby a little bit here to make it easier. I'm going to flip him back over and look at his spine. So I'll run 1 finger down to check for alignment of the spine. It looks good. And then I'll pull the diaper down a bit here. Look for tufts of hair or any dimpling that could indicate spina bifida. And I would also note any scratches or bruising on the back and the color, and he's pink. And he does not have any scratches or bruises. I'll flip baby back over here. And while I have him undressed here, I'm going to check for jaundice. So I'll do 5 spots here. 1 on the forehead and just blanch. 1 on the chest. 1 on the abdomen. 1 on the inner thigh. And then check baby's sclera. And the baby does not have any indications of jaundice. So I'll go ahead and button him back up here. And I also want to check the baby's hips here too. So the easiest way to do this would flip baby back over and pull the diaper down and check the gluteal smile, make sure that it's symmetrical, and it is. And then make sure that baby's legs are symmetrical and they are the same length. That could, if they are not, that could indicate hip dislocation or some other problem with the hip. So now I'll flip baby back over and I'll wrap him back up, keep him warm. And then next I'll test the Moro's reflex. This is where we would clap or make some other loud noise, perhaps hitting the bed next to the baby to scare him. And this, once I do that, he will abduct and adduct his arms and then make a C shape with his hands. So go ahead and clap. The baby had a normal response to that startling. The baby was sleeping when I came in to do the vitals, but he woke up when I started to move him around, and he started to fuss a little bit, which is okay. I would also take note of any stools or if he happened to void while I was doing the assessment. I would go ahead and change his diaper then. I'd also ask Mom when the last time the diaper was changed, and I would ask when his next feed is so I could help her if she needs me. Other than that, the baby's assessment is finished.